Hey, Dr. Jared Pelo here. I'm excited to show you what our blood pressure report looks like. Now, probably when you go to your doctor, you don't get a blood pressure report. They tell you your blood pressure looks great, or it's too high, or it's too low. But remember, we're going to have you collect data for 2 weeks, twice a day. You might think, this is a big pain, Jared. I don't want to check my blood pressure twice a day for 2 weeks, and I get it. But remember, there's really only 4 things you have to fix to make sure you never have a heart attack or a stroke. One of those things is blood pressure. So don't smoke, don't have high blood pressure, don't get diabetes or metabolic disease, and make sure your cholesterol levels are low enough. So those are the things that we're going to work on. Blood pressure being one of those things. Once a year, we're going to ask you to check your blood pressure for twice a day for 2 weeks, and we're going to give you this report. If it's elevated, then we're probably going to have you do it sooner than once a year, and we may need to put you on medicine, although lifestyle changes and behaviors can highly affect your blood pressure. So for this person, for example, their blood pressure report last time I saw it was not nearly as good as it is right now. So let's run through this blood pressure report. So you'll see right here, we kind of explain what their blood pressure report is telling us. And we focus on 3 findings here. Our new blood pressure report that we're just about to release will also contain your 30-year risk of having a heart attack or a stroke, any kind of vascular disease. This comes from the most recent research and ACC guidelines. So I'm excited to share that with you soon. But this right now, you get a letter grade. Just like always, we want to make it very clear, how are you doing? This person gets a B+. And it's not because their blood pressure is bad, it's because their resting heart rate isn't as low as we would like it to be. And we know this from epidemiologic data that if your resting heart rate, if you're under 50, for example, this person is, if your resting heart rate is over 60, then you're not going to do as well as somebody who has a resting heart rate under 60. And so remember, we're trying to optimize here. And if this is like, if I'm a regular internal medicine doctor and I see this, or if I'm in the ER and I see these vital signs, I'm like, well, you are doing amazing. In our clinic, we're going to say, okay, this is great. How can we make it a little bit better? Make sure you live the longest, healthiest life possible. Now, you can listen to that, or you can ignore it and say, hey, Jared, I think I'm doing great. And so for this person, their systolic blood pressure, remember, systolic is when the heart beats and pushes, and is 98.1. We want that less than 120. Their diastolic is 66.1. That is when the heart is relaxed. There's still a bunch of pressure in the system. In fact, there's 66 milligrams or millimeters of mercury in the system still. And that, we want that under 80. And then their resting heart rate, like I said, we want that under 60. And so we kind of give some recommendations here on what they can do to help. And it's really for their heart rate, it's going to be exercise. It could be that it's sleep. And it could be that maybe they took their blood pressure too fast and they didn't actually sit there for 5 minutes like we told them to. But also, of course, we have our wearable data integration. And so we can also see your resting heart rate if you have a Whoop band, or if you have an Oura Ring, or if you have Fitbit or Apple Watch or anything like that. So this gives you a general idea of what our blood pressure report looks like. It's just one of the many reports that you get. It stays in your health records. You're going to be able to trend it over time. Hopefully this B+ turns into an A, and we'll see how this goes in the future. So hopefully this is helpful for you to understand what we're doing here at Bionic Health.